We've got a really shocking story that involves organ donation. The government is moving to shut down a nonprofit after allegations arose that some organs were taken from patients who were still alive. Meg Oliver has that story.
When an organization entrusted with the gift of life repeatedly puts patients at risk, the federal government has the duty to act.
HHS Secretary Robert F. Kennedy Jr. on Wednesday announced his department was decertifying an organ procurement organization, or OPO, called Network for Hope, citing a federal review of 351 cases where organ donations were authorized but not completed. Nearly a third showed cause for concern. The review found with at least 28 cases where the patients may not have been deceased at the time organ procurement was initiated. That includes TJ Hoover, a would-be donor who was hospitalized in October 2021 following a cardiac arrest.
He was thrashing, crying, and grabbing the doctor's hands to stop him. Even after those signs, the organ procurement process continued.
Hoover's sister, Donna Rohrer, alleges their family had initially agreed to withdraw life support after they were told he was brain dead. But the federal review of Hoover's case suggests the next day hospital and organ procurement staff documented improving neurologic function. One day after that, records show Hoover became conscious during a donor-related heart evaluation and had to be sedated and paralyzed so the procedure could continue. That evening, the review says doctors were preparing to remove his breathing tube when Hoover became agitated and they stopped the process. Hoover ultimately survived, and in congressional testimony last year, a whistleblower said the OPO had violated its standards.
The case should have been halted immediately once neurological function improved.
At the time, the OPO said its staff was following approved protocols, and on Wednesday, Network for Hope CEO said his organization would appeal the decertification. For CBS Mornings, I'm Meg Oliver.
CBS News medical correspondent Dr. Celine Gounder has reported on this system for over the past year. She's also editor-at-large for public health at KFF Health News and joins us now. So, Celine, how is brain death supposed to be determined, and what appears to have gone wrong, specifically in TJ Hoover's case?
So brain death is actually a series of tests. So a clinician examines the patient. If they're on a ventilator, you take them off the ventilator to see if they can spontaneously breathe, so without the assistance of the ventilator. And then a second physician confirms it. But in the case of TJ Hoover, none of that happened. And he was on a different organ donation track, something newer called donation after circulatory death. In other words, after your heart stops. He woke up the morning, his organs were scheduled to be harvested, and the organization's own protocol said to stop everything. People did not.
Wow. So Congress has been investigating a wider net of organ procurement organizations. What have they found?
Yeah, and I've been looking into this for over the past year. It's not just Kentucky. This is something I've seen across the organ procurement organizations across the country. In New Jersey, for example, Congress says that a patient came back to life. Leadership told staff to keep going. These nonprofit organ procurement organizations are reimbursed for what they spend, for what they do. And in 2023, HHS Inspector General said that system actually invites abuse, the way in which they charge. And look, this is not a small business. Some of these CEOs of these organizations are making tens of millions of dollars.
So then I think the question is, should we be afraid now to register to be an organ donor? And what should viewers take away from all of this now when they're thinking about it?
Look, I worry that this kind of reporting will discourage people from being organ donors. Donations fell last year for the first time in over a decade. Now, some of that is you have fewer opioid overdoses. That leads to people being donors, right? But in Kentucky, more than 2,100 people came off the rolls perhaps as a result of the TJ Hoover case, just in a period of 4 months. The answer is a system that earns back the trust. You have to behave in a trustworthy way. And so CMS can write better rules. That's Medicare, Medicaid. They can enforce the rules better. Congress can change how these organizations are paid and immunity. House Ways and Means Chairman Jason Smith says they won't stop investigating until every bad actor is held accountable, because families deserve a system they can trust.
Absolutely. Dr. Gounder, thank you so much. This is such an important story. All right.